Good morning. In today's video, we will be studying the chapter of hormones. So, what are hormones? Hormones are basically simply chemical messengers which help to produce the effects of reactions. They don't start any new chemical reactions. So now this chapter is basically covered under the section of endocrinology, and there are four principal types of hormones, which are protein in nature, polypeptide, amino acid, and steroid. You just need to know the principal types of examples of each of them. For example, insulin and glucagon are protein hormones. Similarly, the thyroid hormone and the catecholamines, the norepinephrine and epinephrine, are amino acid derivatives. Similarly, the estrogen and cortisone, or the testosterone in the gonads, is of steroid type. Now we will be covering it in detail. So what are hormones? There are two types of hormone, which are produced in the exocrine glands and the respect and endocrine glands. So the hormones in the endocrine glands, you have to remember them that they are, firstly, they are ductless glands, and secondly, that they travel through the blood. These are the two most important features which distinguish them from exocrine glands. Exocrine glands are always released in the ducts, and they aren't released in the blood. The examples of exocrine glands are the sweat glands and the salivary glands. So naturally, endocrine glands are released to places which are far away from the body, whereas exocrine glands are released to places which are closed from their release of action. Now, the principal organs which are involved in the release of hormones are the hypothalamus and the pituitary gland. Now, first we will be covering the hormones released from the pituitary gland. With the first hormone is the growth hormone. The growth hormone, as you can see, that it is released from the hypothalamus, and then firstly you have to remember that always the first hormone is released from the hypothalamus, and then it acts on the anterior pituitary to further release the hormone. So this hormone, or otherwise known as the growth hormone, is released from the hypothalamus to the life. Now, a few clinical uh, clinical things have been written that if it is released very early in life, it may lead to extreme increase in a person's length, and which is otherwise known as gigantism or acromegaly, which is increase in the person's otherwise hands or feet in comparison to his body. Or if it's undersecreted, it may lead to dwarfism. A famous example is of the footballer Lionel Messi, who who was diagnosed as having growth hormone deficiency. So as we all know that a person cannot grow after the age of 21 years, as his epiphyseal plates have been joined by that time. So Lionel Messi had growth hormone injections, which enabled him to have a normal height of about 5'6". Now we will be covering the thyroid stimulating hormone TSH. So the first thing you need to remember is that the TSH has an inverse relationship with the amount of thyroxine. So there are two types of T3 and T4. So the greater the amount of TSH, the lesser is the amount of the T3 or T4. And therefore, you need to know, it will be covered later in this chapter as well, but I'm just trying to correlate it right now, that the greater the amount of T3 is active form, and it is converted into T4 as well. So the greater the amount of T3 and T4, the greater it leads to hyperthyroidism. And if it is extremely less than the normal physiological quantity, it leads to hypothyroidism. So we don't need to deviate from the normal balance. The TSH is released by the hypothalamus, which similarly acts from the anterior pituitary gland to the thyroid gland and increases the amount of thyroxine in the body. Now we come to ACTH. ACTH is released by the hypothalamus as the corticotrophin releasing factor, which is released by the anterior pituitary in the form of ACTH. Now we studied in the table above that ACTH is basically a steroid. So it releases the steroid hormones such as cortisol and other hormones such as hydrocortisol. And what is the principal function of all these hormones is it is to increase the glucose present in the blood. It is gluconeogenesis. Therefore, these are all also known as sympathetic hormones, since they help in the person to basically adapt into type in places of shock or when he needs energy. Now comes the gonadotrophin releasing hormone. We covered the FSH and LH hormones in detail in the chapter on reproduction. However, the new hormone over here is prolactin. You need to know that prolactin is responsible for the milk production in human females, and it is also released from the pituitary. Now, I'll just come to the anatomy of the pituitary gland. You need to know that there are two parts of the pituitary gland, A, the anterior pituitary, and secondly, this posterior pituitary. Now, the anterior pituitary gland covers about 70% of the total area, while the posterior pituitary contains about 20 to 30% only. So majority of the hormones we studied above are released from the anterior pituitary. You can see the growth hormone, the gonadotrophic hormone, the prolactin, ACTH, the thyroid stimulating hormone. All these are released from the anterior pituitary. And you just need to remember the two hormones which are released from the posterior pituitary. These are namely oxytocin and ADH. Now, what does oxytocin do? Oxytocin is also known as the love hormone because oxytocin, firstly, it makes a person have more euphoria and increases warmness and compassion. And secondly, the oxytocin is used in during labor to help during childbirth. Secondly is ADH. ADH is the antidiuretic hormone. It is released from the posterior pituitary in cases when there is extra very little when the water concentration in the plasma decreases. Therefore, what is the mechanism of the body? The body wants to simply conserve as much water as much as possible. So the ADH is released, and ADH prevents the release of water into the urine. Therefore, water is conserved, and the result is that there is concentrated urine form. Here, the other name of ADH is vasopressin is written. Now, people who have a defect in releasing ADH hormone suffer from the disease called diabetes insipidus. And since they don't release the ADH, they have similarly have dilute urine even when there isn't enough water in the plasma, and consequently they have increased thirst. Now we'll be covering the thyroid gland. I have already told you about the functions of T3 and T4. Now, I'll just tell you the things I didn't tell you previously. Now, the condition in hyperthyroidism leads to Graves' disease, and in both you need to remember that hyperthyroidism and hypothyroidism there is goiter. What is goiter? Goiter is basically swelling on the top of the neck, which is formed either due to hyper or hypothyroidism. So you just need to know the names of these conditions. A Graves' disease occurs in hyperthyroidism, and cretinism occurs in hypothyroidism. Now, what are the physiological manifestations of each of these? These are that in Graves' disease, a person, because hyperthyroidism increases the basal BMR or the basal metabolic rate, a person becomes more agitated, and he similarly has anxiety and trouble sleeping and these types of issues. However, in hypothyroidism, since a person has low energy, a person becomes exactly the opposite of that person. He becomes lazy, he becomes weak, he becomes lethargic, and similarly the manifest bodily manifestations are that he develops scanty hair, he develops a condition known as myxedema. Now, what is myxedema? Myxedema refers to the basically his you will be able to see periorbital swelling. Periorbital swelling means that there will be swelling underneath the eyelids, and this will be due to deposition of excess fat. It will be basically the person will have an overall puffiness on his hands and skin, and this all the in hypothyroidism. The key thing to remember is that mental retardation may also occur. Now I will tell you the function of the two things with the parathyroid gland. So the parathyroid gland helps the body to increase the calcium level in the plasma. Now you need to know that if there is a decrease in blood calcium level, it leads to muscular spasms which are known as tetany, and these muscular spasms occur involuntary. However, if there is extremely increased production of parathyroid gland, now how does the parathyroid gland work? The parathyroid gland works by having an osteoclastic mechanism of action. Now, what is osteoclastic mechanism of action? That as we know that calcium is deposited on the bones, so it tries it to remove the excess calcium from the bones. However, if this function is extremely prolonged, there is excessive removal of calcium from the bone, and it may lead to rickets in which the bones are deformed and basically the person's legs are bowed. It may also lead to kidney stones as excess calcium is released into the urine and it is not the normal there isn't has to the and normally there isn't calcium present in the urine. So there are basically calcium stones precipitated in the urine in the form of calcium oxalate, which later have to be removed by the process of lithotripsy. Now we'll be covering the pancreas, the most important organ of endocrinology. Now, we need to know that the most important hormone which the pancreas releases are the insulin. Now, insulin is an anabolic hormone. What do I mean by anabolic? Anabolic is thing which tries to make things. So naturally, insulin will try to make molecules. It will increase the synthesis of glycogen and increase. Similarly, it will increase lipogenesis, and similarly it will be reducing catabolism. Catabolism is the breakdown of things. So insulin basically helps in the deposition of nutrients in the body. In patients who have diabetes, there is a deficiency of insulin, and therefore the food they eat, the excess glucose cannot be converted into glycogen. Therefore the excess glucose is released into the urine of the body, and they can suffer from urinary tract infections. The other hormone produced is glucagon, which is antagonistic to insulin. It has the opposite function of insulin, and it does not convert glucose into glycogen. Rather, it converts glycogen back to glucose. Glucagon has a catalytic action. It basically breaks down the fats into the respective lipids, and similarly, it breaks down the glycogen into glucose and proteins into amino acids. It is used in the condition where a person needs a lot of energy to perform their metabolic activities on organs, or when he's in a state of fright. Now, I have told you about the abnormalities of insulin, which occur in a person who is diabetic. Now we come to the adrenal glands. The Now you need to know that where are the adrenal glands located. As we know that a normal person has two kidneys, and the adrenal gland sits on the top of the of the kidney, and the adrenal gland has two portions: the outer portion, which is known as the cortex, and the inner portion, which is known as the medulla. Now, the medulla is the portion which releases the catecholamines, which are norepinephrine and epinephrine. So, what are the functions of catecholamines? The catecholamines basically function to help to increase the energy level of the body. They help to increase glucose and have a sympathetic action on the body. They are used in fight or flight response. I've used this word repeatedly during my lecture. So, what is the fight or flight response? The fight or flight response is the response of the body in which a person, for example, if whenever he is frightened, he needs energy to, for example, run or for to attack or to fight. So, there is an sudden increase in energy in the body. Similarly, so apart from releasing energy, the blood pressure of the person is also increased because norepinephrine tends to constrict the blood vessels in the body, and the cardiac output, which even we know the normal cardiac heart rate is 70 beats per minute. It can be increased up to 200 beats per minute in extreme cases, since the body needs more and more amount of energy. And these are all the functions of the sympathetic nervous system. And the other thing which occurs is that the blood flow is diverted to the organs which are used, for example, for running to, and it is moved. The blood flow is basically diverted from the organs which don't need blood right now, such as the digestive system or the GIT. So the digestion we did in the GIT slows down. Now we will look at some of the hormones which are released from the adrenal gland. These include cortisol and aldosterone. Now, I will tell you there are two types of hormones, mineralocorticoid and glucocorticoid. Mineralocorticoid hormones basically have the function of reabsorption of sodium and potassium ions, whereas the glucocorticoid hormones increase the amount of glucose in the body. The principal glucose, as it is mentioned, that aldosterone is the principal mineralocorticoid and cortisol is the main principal glucocorticoid. So you need to remember these information and that aldosterone. Now, apart from being a mineralocorticoid, you need to know that aldosterone has great plasma protein binding affinity, and without aldosterone, there will be edema in the body. So these are some of the whenever we discuss the normal functions of the body, there are always abnormalities also in the body releasing from their increase or decrease in function. So the under secretion of corticosteroids leads to Addison's disease. Obviously, Addison disease will lead to weakness in muscle and loss of sorts, since there will be a decrease in mineralocorticoid activity, or otherwise there will be a reduction in sodium or potassium absorption in the body. The other thing which is completely opposite to it is the overproduction, which is happens in Cushing's disease. In Cushing's disease, there is excessive protein breakdown into amino acids and glycogen breakdown into glucose. So in Cushing's disease, a person develops hyperglycemia, may also suffer from diabetes. Now, the only hormone types of hormones left are the FSH, LH, testosterone, and the estrogen, progesterone. However, we have covered them in the previous videos in of the reproductive system. So this wraps up the chapter of endocrinology. I'll see you in the next video. Bye.